Good day, sir. I am Cariel Twinkle Asgracia from 2BSNA, and today I am going to recite the Discontinuing IV Infusion. First thing to do is check the doctor's order for IV disconnection. Verification of order ensures patient receives correct intervention. And then wash hands. Put on PPE if indicated. Hand hygiene and PPE prevent the spread of microorganisms. PPE is required based on transmission precautions. And then, gather all equipment and bring at bedside. Having equipment available saves time and facilitates accomplishment of procedure. Identify the patient, explain the procedure. Identifying the patient ensures the right patient receives the intervention and help prevent errors. Explanation relieves anxiety and facilitates cooperation. Clamp the infusion tubing. Clamping the tubing will prevent the fluid from flowing out of the needle on the client or bed. Release anchorage of arm, tubing, and needle. Loosen the tape at the venipuncture site while holding the needle firmly and applying counteraction to the skin. Movement of the needle can injure the vein and cause discomfort to the client. Counteraction prevents pulling the skin that causes discomfort. And then, hold the swab above the venipuncture site. Withdraw the needle quickly by pulling it out along the line with the vein. Pulling out in line with the vein prevents injury at the vein. And then immediately apply firm pressure to site using the swab 2 to 3 minutes. Pressure helps stop the bleeding and prevents hematoma formation. And then hold the client's arm or leg above the body if any bleeding persists. Elevation of the lymph decreases blood flow to the area. And then, check the needle or catheter to make sure it is intact. Report the broken needle or catheter to the nurse in charge immediately. And then, if broken piece can be palpated, apply a tourniquet above insertion site. If a piece of needle or tubing remains in the client's vein, it could move centrally and cause serious problems. Application of a tourniquet decreases the possibility of the piece moving until physician notifies. And then, apply the sterile dry cotton balls or band-aid to cover the IV site. The dressing continues the pressure and covers the open area in the skin, preventing infection. Discard the IV container and use supplies appropriately. Items from patient are considered infectious and must dispose in yellow bin. Remove gloves and wash hands. This is to deter the spread of microorganisms. Record the amount of fluid infused on the I&O record sheet and on the chart. Include the type of solution used, time, and reason for discontinuing the infusion and the client's response. This ensures accurate documentation of the client's response. That's all. Thank you.